All right, so without further ado, I'd like to pass it over to Caitlin Ramos and Samuel Edwards of the Massachusetts Archives. Take it away.
Hi, everybody. I'm Caitlin Ramos. I'm the curator of the Massachusetts Archives. I'm going to start today. We're going to kind of do a split presentation. So I'm going to share my screen. Okay, if this looks good to everyone, I will get started. So I wanted to start by talking a little bit about the Massachusetts Archives itself. We collect the permanent, non-current records of state government going all the way back to 1629 with the founding of the Massachusetts Bay Colony. And our records go through pretty much present day, depending on how quickly state records are determined to no longer be actively used by the agencies that are creating them. Everything we accession is deemed a permanent record with lasting historical significance on the Massachusetts statewide records retention schedule. And we work with other state agencies to help them understand how to interpret the schedule and what records they have that need to be retained or can be destroyed once they're no longer being actively used. We have a huge collection. Our most recent estimate is approximately 35,000 cubic feet of material, and everything is stored on site at our facility that was built expressly for the archives in 1985. We have 11 full-time archivists and support staff to manage the collection, including records managers to work with agencies and the retention schedule. We have accessions and processing archivists for managing the intake, arrangement, and description of our collections. We have digital archivists for working with born digital records and records that are scanned to digital formats, and reference archivists who are the public face of the archives. They help members of the public access what they need within our collections. Our collection includes various formats such as manuscripts, photographs, maps, blueprints, artifacts, and digital records from dozens of state agencies such as the Governor's Office, the Adjutant General's Office, the Department of Conservation and Recreation in Massachusetts, and the Secretary's Office. The Archives Division falls under the Secretary of State's office in Massachusetts, as the position is the official record keeper of the state according to our Constitution. So our collection also includes many records from state institutions, as Massachusetts was a leader in institutional care. Today, we'll mostly be discussing records from hospitals that fall under the Department of Mental Health and the Department of Developmental Services, but we also have records from the Department of Corrections, the Department of Public Health, and the Department of Youth Services. Depending on the institution, we have a mix of administrative records and patient or client files, which can be hugely useful for historical research into these institutions and their methods of treatment, but also the human stories of the people that resided there. The majority of our requests come from genealogists and close family members that are looking into their family stories and medical histories. So when I first started working at the archives in 2015, I was part of a then very small reference staff, which was only myself and one other reference archivist. At that time, medical and mental health record research was one of the most sensitive topics that we dealt with. My supervisor at the time was the only person to handle these types of questions because she didn't want anybody else to be liable if we took a wrong approach to release a redaction, and she didn't want anyone to give out any incorrect information. I inherited the process that she established with archives leadership and the general counsel for the secretary's office, which was a very conservative approach to interpreting Massachusetts general laws at the time and the Massachusetts public records law, which was very strict. As one of my former colleagues used to say, all of our records are public records, but that doesn't necessarily mean they're all open to the public, as there are exemptions in the public records law restricting access to certain information. Previously, so prior to November 2025, all medical and mental health information was sealed without a court order, which in my experience, very few people were able to obtain. We couldn't provide legal advice on how to get a court order, and so all medical records were either heavily redacted or really inaccessible. These are just the specific citations for the laws in Massachusetts that we were following. The first is related to records from the Department of Developmental Services, which oversees institutions for individuals with developmental disabilities. The second is for the Department of Mental Health, which oversees institutions for mental health issues. And the laws related to public records relate to records in the custody of the Secretary's office, which the archives falls under. So, in effect, the laws governing DMH and DDS records essentially sealed all records that mention patients from these institutions unless the request is coming directly from the patient themselves, a lawyer working on their behalf, or if the requester has a judicial order. The first two categories are rarely relevant in with historic patient records going back to the 19th century that are held by the archives. And the process of getting a court order permitting access to view a medical record was clearly convoluted. We couldn't provide access, we couldn't provide advice on the process, and we just heard from patrons that it was really difficult to understand how to get started. Following Exemption C of the Public Records Law conservatively meant that even if patrons could find similar information in other records held by the archives, for example, sometimes we have state prison files, and sometimes copies of medical records end up in the prison files. So even if the prison file is accessible upon the death of the inmate, we would still have to redact all of the medical information that was present in the file. So it was still really hard to get around. Because the laws were so restrictive, the process that the archives came up with meant that all patient record requests for state hospital records would be redirected to the state agency that historically oversaw the state institution in question. So even if the archives held records from an institution that fell under the Department of Mental Health, we would redirect questions for how to get a court order to the general counsel at the Department of Mental Health. This was tough. We couldn't even search to see if we had a file in those cases because interpretation of the law restricting admission and treatment to all persons admitted to state facilities meant that we couldn't confirm a file even existed because that would confirm their admission to the institution. So these access contacts that we identified for various state hospitals, we directed our patrons to them for information on obtaining the court orders and petitioning for access to the records, again, even if they were at the archives, which for a family member, the court order was really the only option for getting access to the material. And presumably, if the court order was successful, we would then get a follow-up request for files from that contact at the agency. And when those requests came in, we would do the research, locate and copy a file, and provide access to the agency to then provide access to the original requester. So lots of people involved in the process, which we had multiple issues with this setup. We learned from some researchers that the contacts that we provided at DMH and DDS were not always very helpful, either telling people that records didn't exist or just not providing much guidance on how to get the court order that they needed to see them. We also had no control over the dissemination of the information since we were releasing the records to the agency and not directly to the patron. We didn't know like what format they were getting the records in, if they were getting access to full files, if they were getting redacted files, we didn't know. And not being able to confirm whether or not we had files before the request process was started was really an ethical conundrum for us because the whole process that a person could go through to get this court order is time consuming, it could be expensive, and it could be emotional. And sometimes they would go through all this to get access to a file that doesn't exist because we weren't able to first admit that we did or did not have a file. With medical information appearing in other collections, such as we have correspondence series from like administrators and superintendents of these institutions, like the Walter Fernald School in Massachusetts. This type of correspondence could be super helpful for research into the administrative side of the institution. Sometimes the records still just become inaccessible because the burden of redaction was too great for archive staff. So that's a specific example relevant to the archives. We have a series of 56 record center cartons of superintendent's administrative correspondence from the Walter Fernald School, but the records have client or patient names scattered throughout the boxes and they're in no particular order. So quick reviews of the material to provide access to a person who's researching the history of the school wasn't really possible because we had to painstakingly review every document to see if a patient's name appeared in them. So it was too burdensome for the archives to really keep up with a reasonable pace for redacting the series for someone that was trying to research the history of the school itself. And for commonly requested records like inmate files from state prisons, people are interested in the full files because they're troves for genealogical research, but they also often go into full personal and medical history. So files would need to be painstakingly reviewed before anything could be released. If it is possible to provide access under this process for a redacted copy of record, there were two approaches based on the request that we received. If a request was for genealogical research or a case where the subject is known, we would approach the request by redacting all medical and mental health information within the record itself. If the request was coming from a more academic side of things, where they were looking more at the methods of treatment than the individuals, we would redact all personal identifiers from within the files. We do have policy documents for redaction. This used to be done as an all paper process using paper copies. So, for example, if someone requested an inmate case file from a prison that included medical information, we'd require that they submit requests in writing rather than visit in person because we had to review and copy the full file before we could provide access to it, which obviously takes time. So, step by step, we would copy the full file, which sometimes they could be hundreds of pages of material. Any pages with restricted information were redacted with Sharpie, so copying the copy itself, not the original. The Sharpied copies were then photocopied again to ensure you couldn't read through the marker. And we would insert on the reverse side of that copy an explanatory sheet, basically explaining what has been removed and what laws we're following. And we would then mail this full photocopy to the researcher, keep a copy for the archives, because occasionally people would request another copy, or they could, they have the option of appealing redactions through our public records office. So we might have to revisit our work. So rather than starting from scratch, we would always keep a plain unredacted photocopy of the original file that was requested and a copy of our redacted file as well. This took lots of staff time and lots of storage space. So we usually quoted about 12 plus weeks for turnaround times for those types of requests. Now the process is slightly easier with just the redaction itself. We do things mostly in Adobe digitally. It still does require everyone on staff getting a license through our IT department, which is a challenge too sometimes. But basically now the process is we make a full PDF scan of the file that's requested. We digitally redact any restricted information in Adobe, and then we digitally insert our explanatory sheet naming the laws that we're citing when we're redacting something. And we save the redacted copy to share with the researcher, and we save an original scan again in case we have to revisit our work. And here you can just see an example of this redaction sheet that we're inserting in the files. So this lists all of the various types of information that we could be redacting and the laws that we're citing it. You can see that a lot of these are pretty vague. What constitutes personal information or mental health information, for example? Our staff has gone back and forth a lot on some of these questions on whether or not, for example, to redact descriptions of alcoholism as medical information, or if someone is described to have like a low grade mentality, but that quote is coming from someone who's not a doctor or in a non-diagnostic way. There's just a lot of room for subjectivity with making some of these decisions, and one archivist's redactions might differ slightly from another. So that's just one of the challenges of having to deal with lots of redaction like this. So that was an overview of past ways that the archives had to deal with these types of questions prior to November of 2025. I'm going to pass it to my colleague Sam, who's one of our current reference archivists, to talk about the change in the law and what it's like working with these types of requests now.
Hi, I'm Sam Edwards. I'm one of the reference archivists here at Massachusetts Archives. The reference staff deals with all the front-facing aspects of archival work, so helping people with their research, helping them with genealogy requests, and helping them to access our records, as well as doing outreach presentations and things like that. So Massachusetts Archives holds, as Caitlin kind of went over, change to provide access after 75 years. And I'm going to talk a little bit more about what that looks like and what that entails for us, as well as what the process was for that law changing in Massachusetts. Next slide. So a big part of what shifted the law in Massachusetts was the State Commission on State Institutions. So the image there is some members of the commission with Governor Maura Healey. This was a disability-led commission which addressed the history of state institutions. And an important part of the commission was that there were representatives from each of the stakeholders. So like Department of Mental Health had a representative, Archives had a representative, Department of Developmental Services had a representative, and there are also formerly institutionalized individuals, family members of institutionalized individuals, and then also disabled self-advocates more generally. So it was a broad, it brought together a broad range of different individuals who felt concerned about this issue and about how the state was handling this aspect of disability history. So in 2024 to 2025, I served as the archives representative. And the commission, after many talks about how to handle some of the records access issues in Massachusetts, advocated for the records to be open after 75 years. And that ended up passing in the supplementary budget in 2025. Next slide, please. So the law change took place immediately, which was a aspect of it being part of the governor's supplementary budget. It was a victory for records access and disability history, but it also meant that overnight we had to very quickly develop new processes and have a lot of conversations as we immediately began to get requests. Another aspect of this was that there was a lot of media coverage around this time that I think added to kind of the volume of requests we started to get, which was a great thing, but also meant that we had to very quickly have a lot of internal discussions about what our process would be around this. Next slide, please. So a lot of the ethical considerations that came up around this, and particularly on the commission, but also that continued on as archives passed the law, is questions about what constitutes a medical file, which these records contain a lot more information than just medical information. So it's a lot broader than what we might think of today as like, I go into the urgent care and they, write up a little record about my visit. It contains photographs, it contains family information, it contains sometimes information about people's hobbies, sometimes art that they made, sometimes schoolwork that they did if they were at a school for the developmentally disabled. So one of the questions the commission had was, what constitutes a medical record, and is everything in these files even, medical? There's also the question of, personal privacy for individuals versus the public good of collective history. So although personal privacy for individuals is important, we also want to keep in mind that at a certain point, the collective good of history kind of outweighs that, in the sense that, for someone from the 1800s, if we don't know anything about them at all, then, the collective good of history kind of outweighs that. That at least is the argument that the commission made. So another question was how much privacy do we allow deceased individuals, which is an ongoing question, but I think one that has kind of erred more on the side of access in Massachusetts with the passing of the new law. Also, I apologize if there's any background noise. I'm in kind of a noisy area. Next slide, please. So some of the challenges with the passing of the law were we had to very quickly address processing and inventorying, which these records were largely processed in a lot of cases, but because they were not being regularly served to patrons, they were pretty minimally described. And then we had to process them with a new eye to patron access in a different way, because now they were being served not just on occasion when someone needed their own record, but were being served on a weekly basis. So quickly we had to think about changing the ways that we processed and looked at these records, as well as kind of how we arrange the physical space. That image there is our record center, which a lot of our, not a lot, but some of our state hospital records were stored in our record center at the time, which, as you can imagine, if we're regularly serving these records, it's not really practical to have them in this, uh, kind of storage where you need a cherry picker to access them. So, um, so hold on one moment. So the physical space, we had to quickly move a lot of those things that were in the record center to our vault space so that they could be accessed by reference staff on a more regular basis. As I said, a lot of conversations happened between reference staff and curator about what was as well as with our general counsel about what was our interpretation of the law, how were we moving forward with providing access for these, etc. Next slide, please. So some of the big positives of this is its significance to disability history in Massachusetts and the history of medicine, history of um, mental health. It also means that family members are able to get uh, answers that they were never able to before. One of the main things that got a lot of media coverage was an individual affiliated with the commission who found that it was, he was encountering a lot of barriers trying to get his brother's record. So that's something that has changed in the new context, is it's much easier for individuals to get answers about family members they previously knew nothing about. And I've, even as reference staff, been personally thanked multiple times for providing these files to people who, may have known nothing about their relative other than name on a census record, which in a lot of these cases, we're encountering individuals who may have been institutionalized for their entire lives. So they may have, been children at Walter Fernald School and then gone on to state hospitals. So those really are the main records of their lives, are the ones that exist in institutions. So hearing those personal stories, even when they're sometimes, difficult or challenging to hear, does make the hard work worth it. And definitely, these are at least some of my favorite files to work with, in the sense that I just think that it's very satisfying to be able to provide individuals with that kind of closure that they weren't able to get before. Next slide, please. Some of our takeaways for other archives, and of course, the context is going to vary from state to state, and state laws vary. Know the law, including HIPAA, but don't be afraid of it. We have often found that, archives can kind of throw up their hands and be afraid of, interacting with state hospital files, or at least, that's, the perception on the patron end. It may look different for the archivists actually dealing with the files, but that can sometimes be a barrier to access. And, if it is very restrictive in your state, know the ins and outs of that law, but also know that those laws can potentially change too through advocacy work, as it did in Massachusetts. Prepare for processes to change. So our processes shifted very radically in Massachusetts, as you can see from Caitlin's part of the presentation, as well as seeing my part of the presentation. And you need to, throughout that process, be adaptable and shifting to, be considering all the aspects, which is both the respect for the people in the files, as well as respect for the living individuals who are asking for these files. And then always remember, the why of why we're doing this, which is, a dedication to history and to serving the public. Next slide. Right. That is it for my part of the presentation. Happy to answer any questions along with Caitlin that may have arose from.
So if you want to, you can put a question in the chat, or you can use the raise hand function, and I'll call on you if you want to speak your question out loud. Jorge put some great questions in the chat, although they are quite extensive, and I don't know if it's something that's really more of a question that I think will take a lot of people to answer. So if anyone has thoughts in the audience, go ahead and respond to Jorge in the chat. Maggie says, how many state hospitals are active in Massachusetts? Just curious, are you still receiving records?
Yeah, so there are state hospitals that are still active, although I think they are run in a very different way than they were in the past. We're still receiving records in that we're still receiving historical records, but there was a large deinstitutionalization movement in Massachusetts in the 70s through the 90s. So state hospitals look a lot different than they did in the past, if they still exist. Like the physical buildings might still exist and they might still provide mental health services, but the nature of those services, of like, people being institutionalized in, very long-term in facilities, is pretty rare at this point in Massachusetts, is my understanding. But we are still receiving historical records. I know that our accessioning and processing team has been working on kind of consolidating the state hospital records that are out there, some of which are, held by private institutions, and some of which are still held by the departments. So yes and no. We're not really receiving records that came from the very recent past at this point. But certainly we are receiving more historical records. I think we're also just not really actively going after more recent records to accession, due to the fact that we wouldn't be able to provide access to them at this point. So they're better served by the agencies.
Yeah, the influx of new transfers to the archives of historical records is also a result of the work of the commission and the passing of the law. Now that we're able to provide access to these, even earlier than like people who work still with records at DMH and DDS, there was a separate side of the law that changed on their end that said they could release certain records after 50 years after the death of the individual. So in some cases, some of the records are more accessible if they're at the archive. So it's just brought in a lot more attention. A lot more of the historical records that had been kind of floating around out there are finally coming to the archives where they're safe and we can provide access to them.
Suzanne, would you like to unmute and ask your question?
Sure. Hello. Thanks. This was fantastic. I'm a researcher and a professor. I live near Boston. And I'm really curious about what the process is like now because I've done a lot of research in Providence and used the Rhode Island State Hospital archives. And my interest is in the late 19th and early 20th centuries. So, what is the best process process now for researchers in terms of figuring out if coming in makes sense or if there's digital materials or what's the process?
It's definitely still a good idea to, even though our records are stored on site, for these types of records to reach out to the reference staff first, especially if you're approaching from like an academic research angle where you might want to look up at a broader collection than just the file of an individual, which are most commonly requested medical files are just an individual for a specific person who's related to them. But we do work with historians and academic researchers. But those are trickier because if you're familiar with working with archival records, you usually don't have a nice clean system where you know
Mhm,
which box a date cuts off at, because especially like Sam
mhm.
mentioned, these are institutional records where sometimes people were in institutions for their whole lives. So if a series is arranged by admission date, for example, you might think that you're in a safe area of a box where everyone was admitted safely over 75 years ago. But really, with the interpretation of the law, it's if the date of record is older than 75 years, we can provide access to it. But within the same file, we could have records that predate 1951 and those that go after 1951. So we still have to review material before people can access it just to make sure that the files don't contain any records that go beyond the date where we can safely provide access to it. So work with the reference staff, explain what you're looking for, which institutions you're focusing on. And yes, a big part of the change is since a lot of these records weren't previously used as much, they weren't very well described. That's a lot of the work the processing and reference department is working on now is we're kind of rediscovering search methods that we had never used before. So indexing we haven't used a lot. So yeah, there's still a lot of stuff that we're figuring out. But we're happy to work with everyone. Anything to add, Sam?
No, I think you covered it there.
Before I get to you, Dave, I'm going to bring up some questions from the chat. So a lot of folks wanted to know why 75 years was the time limit chosen. And then some people expressed concerns that this means that living people who were treated when they were young will have their very private information revealed without their consent. It seems the convenience for the archivists and access to researchers are weighed as more important than patients' rights. And then someone else brought up, why is it 75 and not 50 years, matching HIPAA rules? So I think that there maybe needs some clarity around what 75 means in this case, if you know, because
Yeah,
that's not always clear.
yeah. I mean, I think I can speak a little bit to that. So there's two questions there, right? There's the why and also the how is it implemented,
Mhm.
and how might it affect living persons. I think the why is because the commission did a lot of research on how other archives were handling these records, particularly archives that were providing some level of access. And I saw Jennifer Wagner mentioned the Minnesota Historical Society. That was one of our kind of models that we were drawing from that kind of gave us kind of some of the inspiration for our 75-year rule. So we were kind of basing it off of, what else was out there in the archival landscape. People felt like 50 years was maybe too soon. The question around the how of the implementation of concerns around living individuals, I do say we take that very seriously. In Massachusetts, we can restrict anything that at our discretion that's private information, which includes medical information of living persons under exemption C of the public records law. It hasn't come up that we were, asked about the record of a living person, or at least it hasn't come up for me. But I think we would handle that on a case by case basis. In majority of cases, people are asking for, long deceased relatives. So it often isn't relevant to the majority of our requests. And I think if we felt there was a concern around releasing a living person's information, we would be able to withhold that under exemption C.
Mhm.
Uh, Someone else also asked for records under 75-year threshold. Is the workflow the same? Would they still need to contact the creating institution, or are you now allowed to provide more guidance?
That's actually something we're still working on. So part of this is having to work closely with people at the Department of Mental Health and Department of Developmental Services that have to also follow changes in the law. And we are still working out a workflow with them. Currently, yes, if the records are less than 75 years old, we're directing them to those agencies to get some advice on how to proceed, because if they're at the archives but they're not 75 years old yet, we cannot provide access to them unless there is a court order. So we're trying to make that process a little bit easier for people, but there's no public documentation yet on the full process. It's really just case by case when it comes up. We're directing people for help to DMH and DDS.
Dave, would you like to unmute and ask your question?
Hello, everybody. I'm glad I made it today to listen to what all you folks had to say. I'm just curious about Northampton State Hospital. Does that sound familiar to you? Okay,
Yes.
it does. Great. Now, my grandmother was committed there in the late 50s, and years and years ago, I tried to get her records, but I was stonewalled, obviously, because it was probably too early. But I know she was there until 1959, probably 57, 58, 59. So that
Mm-hmm.
kind of takes care of the 75 years that you folks have been talking about. What are the chances that I would be able to get a hold of some of her records? Because part of the reason she was institutionalized was she was a drug and alcohol abuser in Alabama before she moved to Massachusetts. Um, and I still want to know if what her issues were. I mean, it's my kids are all adults with kids of their own, but I'm just worried about what might be passed along genetically with in my side of the family. So with those, how would I go about requesting those records?
So the handout that is going to be shared with this meeting is our state institutional request form that we
Okay.
created after the change in the law. And yes, if you requested this years ago, we wouldn't have been able to provide access to anything. But based on the dates, you can fill out a request form, submit it to the reference staff. We could search our various series. I pulled up while you were talking our information for what we have from Northampton, and we have a lot of records from Northampton State Hospital. Um, if she was there through 1959, it might be a
Hmm.
case where earlier records of her time there would be accessible to you, because right now we're through July 28th, 1951 is what we can provide access to. So you might get access to a partial file or just admission information. But really, your question is why a lot of people are requesting these. They're looking for their own medical history, and they
Right.
want to know what's going on with their families.
And what's maybe going on with me?
Yeah,
But
it's very personal.
of course, the hospital is long gone. It's
Yes.
all torn down, and it's a retirement center or something. And so what you're giving me today is will be very helpful. So I'll look for the document that you're referencing and take it from there.
Mhm.
Yes,
Thank you
and
very much.
I will send out that document to everybody with the recording later this week. So look forward
Okay,
to that.
very helpful. Thank you.
So another question we have in the chat is, uh, who was the main driver behind the establishment of the State Commission of State Institutions?
Yeah, so there was it was kind of a coalitionary commission between multiple individuals within kind of the disability advocacy world. I know that if you look up information about the commission online, two of the names that come up a lot are Kate Benson and Alex Green, who are both disability advocates and scholars in this realm as well. But obviously, it was a joint effort by everyone within the community.
Another question, can you speak on your experience or any tips for queuing, guiding patron expectations for all those back-to-back requests?
Yeah, that is definitely something that comes up for sure. I think we have been letting patrons know that it can take up to a few weeks to do the full process of digitizing these files. We tend to send updates as we have them. So if we've located a file but have not yet digitized it, we inform the patron of where we're at in the process. Most people have been pretty understanding about that. And I think most people that I've worked with have been just excited to be able to access these in general.
Do you have policies around what constitutes academic research and who can access the files?
We don't, and that's actually something we've talked about for a long time, because even before the change in the law, like we know it exists elsewhere where sometimes an academic researcher can fill out basically an application talking about their project and kind of getting a work around the law, but that wasn't something that our office was really open to doing. And really the way our general counsel sees it, they see it as open to one, open to all. So I saw like another question in the chat about like widely digitizing records, or if we're permitting people to come in and take photographs or film what they're looking at. And really it's if we're providing access to one person, we should be able to provide access to anybody. So it doesn't matter if this is your relative or if you're an academic researcher. If the record is over 75 years old and the staff has determined that it is not something that we should be restricting under privacy exemption C, then anybody can come look at the records.
Okay, so does this building off of that, the question is, does this expanded access include digitization, or have you decided that these will only be served in person? I'm assuming that none of these records are currently digitized. And is there any plans for digitization in the future or thoughts about it?
Someday, I think certain types of them would be good candidates, not things like patient case files that are very focused on individuals. It would be more maybe someday in the future doing more like admission registers for safely old enough records. I saw somebody else mention Family Search in the chat. Family Search is a website run by the Genealogical Society of Utah that we've worked with for years. Previously, they came to the archives and microfilmed a lot of our collections, and they've since moved away from microfilm, digitized all the microfilm they created, and now they're just doing digital scans for any new projects. But yes, it was actually, it did happen many, many years ago, before a lot of the clarity about these laws was ironed out, that some of the very early state hospital records that we hold were digitized, which is not something we were actually able to really publicize to people. But we would let them know that if they're able to find them on Family Search, some of them are out there. So I think the question was if we are going to update what's on Family Search. Currently, we don't have any plans for that. We have enough just trying to work on each request as they come in at a time. But yes, absolutely in the future, I would not rule out any digitization projects with some of the more useful broad types of collections that can be used as like access points.
Okay, a few more questions about digitization. Do either of you know if the Massachusetts archives might include historical photographs, documents, plans for Taunton State Hospital and other Massachusetts state hospitals.
Yeah, I don't know about Taunton specifically, but we do have a large collection of architectural plans. They are somewhat restricted in that you do need kind of a reason to access them. It's mainly architects and historic preservationists who are accessing them, mostly just because of concerns around safety with buildings that are still standing and active. But we do have some architectural plans from the state hospitals.
Okay,
Yes.
thank you, Samuel. I'm asking because I am an architect and preservationist with Preservation Works. I'm the spokesperson, and we are, as some of you may have heard me drop in before, we are focused on working with communities to preserve and adaptively reuse surviving Kirkbride Plan hospitals. Of which there are 35 remaining of the original 80 that were built across North America and Australia. And so I'm asking in part because I was working with a colleague I had already written the introduction, and it was to produce one of the books for the Images in America series focused on Taunton. And he had done research work on the one on Danvers, in fact, and he's from Massachusetts. But he and his collaborator were unable to access enough photographs to convince the press that it was worthwhile to actually produce as a book. So I had already written the introduction, because we know the work, and it's a fascinating history, not only Taunton, but Northampton and other Danvers and other Massachusetts sites too. So if there's any kind of a lead, Caitlin or Samuel, I would very much like to follow up on that. And the other thing I would just note that is interesting in hearing all of this work and research and sitting in with this group over the last several months, and part of the reason I will be there in Austin joining you in September, is precisely to compare notes, because other groups, I've been in Buffalo State Hospital, and there are still boxes of private records of patients that are sitting there open. And we know that a lot of the state facilities in different areas, including Hudson River State Hospital, which unfortunately suffered a terrible catastrophic fire in the beginning of June. A lot of the quibbles about privacy is ironic because many of the states actually did very bad work retrieving their own materials when they closed down the facilities. And that's not just one or two cases. That's a pretty regular, consistent story. So it seems somewhat ironic to be framing so much around privacy when it seems far more about fear of liability and things like that from a hindsight perspective. So I don't know if in the 2024-25 revision to the Massachusetts rule that you were describing, Samuel, to what extent was that really candidly addressed?
Yeah,
That the genetic material that Dave was raising earlier, that's a real driving concern for many American citizens. And yet the privacy is held up as the standard, and yet is it really that?
yeah, the commission certainly talked about that a lot in many of our conversations, and I appreciate you bringing that to the forefront. In terms of your first question about the architectural plans, I would recommend you reach out to us about that, because I think we do have a material that would be relevant for your book, and it certainly seems like an appropriate project for that.
Mm-hmm. Yeah, quick search confirms we at least have architectural plans. I don't think we have many photographs.
And Robert,
well, I'll follow. Go ahead.
Oh, I was going to say I would check the chat. Tyler Stump has said that the Pennsylvania State Archives have buildings and plans from a few Kirkbride style institutions as well.
Wonderful. Thank you. If anyone has any other leads, I'm most grateful. Thank you.
Okay, so we have 5 minutes, and I have one last question from the chat. Are the archives concerned about or planning for the collection storage space needed to house more recently created patient files as they meet retention and are transferred? I imagine early patient records are a fraction of the size of the patient files created and maintained from the 1960s forward. I believe you talked a little bit about this, but maybe expand a little.
So the retention in the medical records in Massachusetts actually has changed over time too. So so we received a lot of the historic ones a long time ago, and since then the retention on a lot of these has changed. They're not permanent anymore. Like Sam mentioned, there's since the institutionalization itself changed, the record creation changed as well. Records that are created became much more voluminous and less substantial about specific individuals generally. So moving forward, we'll always be open to receiving transfers of modern records that upon archival review look like they will have historical significance over time, if it's like landmark treatments or cases. But we are not expecting to have to take in every medical record that is created in perpetuity because of that change in the retention schedule. But space is always a concern, since we are just one building and everything we have is stored on site. The storage is limited, so we had a vault expansion project a few years ago where we were able to change. We didn't change the footprint of the building, but we're able to transfer some of that record center storage space that Sam had a picture of in his presentation to vault storage space that's easier to access the material, better temperature and humidity control, controlled environment. So eventually we'll have to do that again, where we're going to have to make more vault space in the building just to keep up with these records, along with everything else that we're receiving every year. But no, we're not going to be taking in all medical records moving forward.
Well, thank you all so much. If we just have a few minutes left, and I don't see any more questions in the chat. So thank you again for joining us and sharing with us about the changes in Massachusetts and what you've done to address them. We really appreciate it.
Yeah,
Thanks
thank you for having
everyone
us.
for attending.
Okay. Well, have a good rest of your day, y'all.
You too. Bye-bye.